Hello, I'm Dr. Amarchand from VERVE Medisimuhub, and today I'm going to demonstrate our mannequin that is for doing resuscitative hysterotomy or perimortem C-section. And this is a very high-stake procedure, and you need to get this procedure, sometime in life, and for that you need to do deliberate practice. And I'm of the opinion that all high-stake procedures we must do deliberate practicing so that when the occasion comes we can perform. So before we start, let's ask Dr. Bilal. Do you have any question, Bilal?
Yes, of course, I do have some questions regarding this one. Firstly, why we are doing this process?
Oh, that's a very good question. Why we are doing this? So basically we are doing this, the resuscitative hysterotomy, to save mother. Because as the name indicates, it's resuscitative hysterotomy.
Right.
Okay, so basically and primarily this is for the mother, but if baby is survives, then it's okay.
Yes, then
it's good.
Fine. Right. So this is the first. The second thing is the survival chances for mother and the child.
Yes, right, absolutely. That's very fantastic. See, if you do it in a timely manner, then the survival, hitherto like it is used to say, like within 5 minutes you should do. But nowadays, you can do up to 15 minutes. And the survival chances for mother is up to 32%. And for baby, it is up to 50%.
50%.
Okay, so these are very good chances if you do in a timely fashion.
Absolutely. So after this one cardiac arrest has been taking place, then how much time we will take to go for a process? That will,
absolutely,
increase
yes. That's very important.
Yes.
So you should give a couple of cycle for CPR, and usually they say within 5 minutes.
Right.
Okay, usually within 5 minutes you should commence when you expect that ROSC is not going to be there, and then you should start your,
the
resuscitative hysterotomy
well.
within 5 minutes. But if you, like as I said earlier, up to 15 minutes you can do. Like if the patient arrests outside and she is brought to the hospital, so if 5 minutes have lapsed, doesn't matter. You can go up to 15 minutes. Okay.
Right. What about the incision? Why you will start the incision and how long you can go through this?
Absolutely. That's very relevant. So we have to go from bone to bone incision, from the G5 sternum to the pubic symphysis. It has to be straight cut.
Right. Okay. From this bone to bone.
Bone to bone is incision.
And after that, what needs to be done to take care of the surrounding organ of baby inside?
So after giving the incision, we expose the uterus. We give a incision in the uterus, and then cut the uterus, extract the baby, and hand over to the neonatologist.
How the teams that are involved in this process?
Yes, ideally we should have 3 teams. One for the ACLS, second for the perimorten C-section, and the third for the baby, for baby resuscitation.
Absolutely.
3 teams, but doesn't matter. If you don't have 3 teams and you are alone and you are capable of doing this procedure, you can go ahead. Absolutely, you can do it alone also.
So what are the instruments that you're using in this? The tray that basically compose the instruments?
Yeah, that's very good question, because as I told earlier, this is like once in a lifetime procedure, and usually maybe you don't have that perimortem C-section tray. So what can you do? That you can use your resuscitative thoracotomy tray, because all the instruments we need for this procedure, they are there in the resuscitative thoracotomy tray also. So there you can use that tray.
Right, so the instruments are the same that
you are
using?
We need basically one blade, 2 carries and 1 scissor.
Right. So lastly what I want to ask is how, you are doing this and want to know that the risk factors around it, how courageous it is to carry the process forward.
Yes, this is absolutely challenging, and only daredevils who has done some other high stake procedure or has done deliberate practice, they can perform this. And risk are like sometimes you can injure bowel, but that's not our priority, right? We can take care of the bowel later on, but you see, when uterus is enlarged, it usually displaces the bowel on the either side. So usually, there's not much risk involved in this process, except that you should be careful. You should not injure yourself with the blade, because as I said, this is a high stake procedure, and sometimes in surgical cries or in resuscitative thoracotomy and in resuscitative hysterotomy,
Yes.
one get injured. So you take care of yourself also.
Okay, what are the success rate of this procedure? I mean, after we have gone through this, and then how long it will take to say that those are the percentages?
In percentage, I have already talked about. Like for mother, it is 32%, and for baby, it is 50%.
Wonderful.
And now I will demonstrate the procedure.
Right. So
Okay.
yes, please.
Okay. So again, as I said, you come to the side for unit for the baby. Okay.
No problem, sir.
So as I told, bone to bone incision.
Right.
Okay. So from the sternum
Yes.
to the
This is the face turner. The incision will be straight from bone to bone, right?
yes.
Yes.
You take
This is a
a
wonderful.
couple of swipe.
Yes. Yeah. There we go. Yeah, we are just moving downwards towards uterus.
So as I told, be
Yes.
careful not to
Yes.
injure yourself.
Exactly. Yes.
You can go through the
Umbilical.
so because this is also thinned out.
Straight
Okay.
out to the pubic bone, right, sir?
Okay.
So then the next
So-
step.
So this is our uterus. Hold like this. Hold.
Yes, hold this one. Only this, that one. Just not here. Just both hands here and here. Yes. Exactly. This is very
So-
how
so this is
important this? Yes.
Okay. This is very important. So
Yes.
this is our uterus.
Right.
Okay.
Yes. Yeah.
So give a incision.
Yes. This is the incision that we remove the baby through this one, right, sir?
Yes. Yes.
Right.
You may get some fluid,
Right, sir.
but then you have to insert your finger
Right.
and
Yeah.
cut the uterus so that you don't injure the baby.
Baby. Right. Wonderful. Yes. Right.
Light दिखाओ.
Can you, light? You just come here. Don't worry about this. Yes. Give it to me. Yes. Show the light.
So be careful.
Yes. The incision should be enough big to remove the baby.
Hold from here.
Yes.
Now we will extract the baby.
Right.
ऐसे भी करेंगे. Take some time.
Yes.
It's slippery because of the liquor.
Exactly.
इधर दिखाओ, इधर दिखाओ.
Yes.
Take some force.
Yes. It's coming out, getting out of.
Hold the uterus.
Absolutely. May I help somewhere?
No, it's coming.
Coming. Yes. This is the baby. Yes.
So we cut the cord.
Yes.
Hold.
Yes.
Near the baby.
Yes. Both sides we will. Exactly. Yes. Absolutely. Yes.
Okay. Now
Maybe I'm carrying
We will-
it towards the.
remove the placenta,
Okay.
and you see that it is
Where is
in
this in this
one piece.
Yes. That's all.
And now you can just pack the uterus. Pack. And you can apply staple.
Alright, sir. This is the uterus
And,
that you removed?
You can
Placenta.
start your ACLS. So this is a very high step procedure and need deliberate practice.
Right.
And we have devised this mannequin for deliberate practice. Thanks for your time. Thanks for watching video.